Engrossed committee substitute for Senate Bill 420, increasing tax rate on cigarette and tobacco products. Third reading of the bill.
Question on passage of the bill. Senior Senator from the 4th.
Thank you, Mr. President. I think it's of no surprise some of the things I'll say today. I think everybody's kind of familiar with this bill, but let me just touch the highlights. This bill was introduced as one of the governor's revenue measures for FY 2016 and 2017 budgets. Its original form, it would have generated about $18 million or almost $19 million for FY 2016. With the amendment, it generates actually $11 million more for 2016, and $78 million for 2017. With the amendment, it's somewhere in the range of $113 million, I think, is the revenue estimate, somewhere in that range. There was an amendment made, obviously, on the floor also to the bill that came to the floor amended by the Finance Committee, which basically captures the revenue, pending this bill makes it all the way to passage and signed by the governor, that the revenue increase of $40 million based on the extra 55 cents that's in this law would be captured for the general revenue for fiscal year 2016 and 17. And then beyond that, from July 1st of 2017 on into the future, every year the money is set aside for the reserve account of PEIA, and let me explain what that means. What that does not mean is that this goes to the premium side of the PEIA, because those who know that when we commit money to the premium from the state, that the participants have to pay 20% increase as well. It does not do that. It just puts it in the reserve, and the director of PEIA and the board themselves can draw from that reserve going forward in the future. I'm told by the director that he can use those funds to keep the plan relatively whole, the benefit structure similar to what it is now, and there shouldn't be dramatic premium increases in the future. So for those who interpret that as making PEIA whole, it sounds like it does. So the provisions are that tobacco tax on cigarettes would be raised to $1.55 a pack, and other tobacco products, the OTPs they're called, I guess, go from 7% to 12% at their wholesale value. It imposes a tobacco tax on e-cigarettes by taxing e-cigarette liquids at 7.7 cents per milliliter. I think that's right. These changes would take effect also April 1st, 2016, beginning 2017, July 1st of 2017, and each year thereafter. The additional 55-cent increase would be in place. The first $1 million of that increase is dedicated to DHHR for tobacco settlement programs, and the rest will be dedicated to PEIA. That's what would happen beginning on July the 1st of 2017 and going forward. I believe that explains it. Be happy to answer any questions.
Questions on passage of the bill. Is there discussion? Senator from Marion.
Thank you, Mr. President. Ladies and gentlemen of the Senate, I also rise in support of this piece of legislation. And I would like to have members take into consideration, this is more than a tax bill, although it has far-reaching implications as far as balancing about 3 years' budgets and taking care of our PEIA problem. But I think more importantly, this is a chance to do something different. You know, what has worked in the past hasn't worked. We have more adults smoking now than ever, more youth smoking than ever, and we also have more pregnant ladies who smoke. So I think by increasing this tax, we're going to look at a very important health impact on the state of West Virginia. We have more people dying from smoking-related illnesses, and our teens, that's what really I'm concerned about. 2,200 youth begin to smoke each year. If we can put a dent into that, it's going to have far-reaching implications as far as the future of our economic impact on our budgets and on future budgets and on our health programs. It costs the state of West Virginia about $2 billion a year in smoking-related illnesses. $2 billion a year. We have numbers that indicate that we have $277 million that we pay to Medicaid for smoking related. If we can eliminate, and we can eliminate by doing some behavioral modifications, you know, I don't hold out much hope that adults that smoke need to smoke, because we all know that nicotine is probably the most addicting drug that there is. But if we can make an impact on our youth, I foresee that we can make a great impact on this state. And it's for those reasons, not just for the money, but for the health impact that we're going to have on our state. Mr. President, I support this bill, and I hope every one of us will.
Further discussion? The Junior Center from the 8th. Junior Center from the 17th, I'm sorry.
Thank you, Mr. President. I, too, rise in support of this bill. You know, when I joined the legislature, everyone talked about how unhealthy our state was. Everyone runs that statistic off, and, you know, we're the most obese, we're one of the most unhealthy states. Well, one of the things that we can do with the fastest, greatest impact that we can possibly affect our state health is a smoking tax. Now, you know, proponents of this say, well, but it's my right to smoke, and I agree with you. But the choice of 27% of the population of West Virginia affects 100% of every citizen in the state of West Virginia. So I don't think it's unfair to ask them to shoulder a little bit of the burden of the cost that they're costing everybody. $2 billion is a big number. I think our Blue Ribbon Commission said $1 billion to fix a road. Well, if we could impact smoking, we can do a lot of things in the state. When you talk about jobs, which we all are pushing and trying our best to stimulate job growth, well, one of the big things for young people is a healthy state. They don't want to come to an unhealthy state where they can't go out and enjoy themselves without their lungs being filled with cigarette smoke. It's going to be a generational change. A $1 increase in this state, per the American Lung Association, shows not even a 12 but a 14% impact in smoking cessation. Now that's a big number in terms of cost. It's predicted we would save $44 million in medical cost alone. That's not to include other things such as the economic impact on jobs. When you're an employer and you've got people out smoking around the corner all the time, they're not being very productive in the workplace. The other things that people don't realize is hospitals are under tight budgetary constraints, and one of the big things that CMS is doing is dinging hospitals for readmissions for COPD. Chronic obstructive pulmonary disease is almost a primarily tobacco-induced lung disease. And when you come back in 30 days after being discharged because you don't take your medicines, because you go home and smoke and you re-inflame the lungs, hospitals aren't going to be reimbursed for that. Where's that bottom line going to come from? What's our hospitals going to do? How's innovation going to happen when they're having to foot all of the costs for that? The rest of the country has shown a steady decline in smoking, except for the state of West Virginia. Even when you talk to state medical, Dr. Gupta with public health, they thought, well, maybe it's a regional thing. They've looked at the states around us. Every state around us continues to see a gradual decline in smoking, but West Virginia remains static. When you talk about smoking in pregnant women, if you talk to the neonatologists, they'll tell you patients that are addicted to narcotics, crack babies, it's violent. We've all seen videos and the little infants violently shaking, but those can be weaned off. It takes a few weeks. They can be weaned off, but the effects of smoking in utero is lifelong. That's permanent. The only other point I would talk about is there's a lot of discussion amongst members of this body and of the House regarding drug addiction. We are second to none. 34 of 100,000 people in this state die from overdose deaths. We're number one by far. Second place is way down the list. But multiple studies have proven that the effects of nicotine is far more addictive than that of heroin. If you look at statistics, West Virginians are dying at a rate over 10 times that from narcotics overdose. Yet we stand here and do nothing about it. I mean, there's very limited things you can do. The only thing statistically, other than education, is a increase in the tobacco tax. And then the question is, well, how much? Small amounts haven't shown benefit. It has to be $1 or more. You have to hit somebody in the pocketbook enough that they say, okay, well now I'll quit. And what is the worst thing that can happen? You know, when you quit smoking, you breathe better, you feel better, you live longer, you get to be there for your grandbabies and your children's graduation. In terms of finances, on average, it's about $4,700 back in your pocket, and in a state that has workforce participation and some issues like that, that's a big number. That can help out a lot of people, $4,700. That's cash. So for these reasons and more, I stand and support and hope we vote yes.
Further discussion. Senator from Wayne.
Thank you, Mr. President. I rise in support of this for a couple reasons. My wife, who runs the Byrd Center for Rural Health, has seen actually just what this junior senator from the 7th was talking about in terms of what, or the 17th, excuse me, that was talking about. In my estimation, we went on the PEIA side in 1994 and 95. I was the only one dumb enough to agree to be head of the select committee on PEIA. And you think some of the things that we're doing right now are tough. You do something that looks at that. At that point in time, we were paying the state was putting in 96% of the money, where the individuals were putting in 4%. We were on a cash basis accounting system, not an accrual basis accounting system. We were in such bad shape in 93 and 94 that we had to do something different. What this bill does is takes us a step in the right direction, because, quite honestly, tobacco is a major reason why our health care costs on PEI are up. So there is a direct correlation between this and what's happening with PEIA. Therefore, I think that the senator from Marion's amendment that he talked about, and actually the way that the senior senator from the 4th from Putnam had articulated, was the right way to structure the money to be able to use it in the best manner as we move forward. Having gone through those struggles on PEIA, to get to an 80-20 plan was not easy. Staying there is something I think we need to do, because if you look at it from a business standpoint, most businesses are on an 80-20 plan. They continue to do that. Right now, we don't know what the health care costs are going to be, and particularly in a state when we have hospitals that only have 4 major payers into those hospitals when they stay there. I think this is a step in the right direction. I think that the tax is one that you can sustain when you go back home, in the fact that you were trying to help not only tobacco cessation, but you at the same time were trying to fix PEI, as well as some of the budget revenue shortfalls we have right now in this upcoming budget, the budget we're in right now and the future budget. Thank you, Mr. President.
Further discussion. Senator from Nicholas.
Thank you, Mr. President. You know, one of the things that I've been contacted about throughout the course of events dealing with the budget and dealing with the issues over the course of this last few months has been something that the esteemed gentleman from Wayne County talked about, which was PEIA. PEIA is funded within our budget, and we've heard the senator from the 4th talk about that as well. It's in Article 20, Article 28 of our budget. The governor provided us information that showed that Public Employees Insurance Agency is funded within the budget. And I just want to assure the people at home, more than anything else, that the things that impact our public employees and our people at home, the governor has indicated certain things within that. Public Employees Insurance is just a part of that. The part we're talking about here is this particular tax legislation that the governor's proposed, necessary in order to fund the budget. Doesn't impact necessarily one particular line item, but it funds the budget. I agree that we had to find other locations where we could raise revenue. And in this particular instance, we have an additional revenue stream through the amendment that was attached to this particular piece of legislation that allows us to be able to realize the necessary revenue to operate the state off of. Our people at home need to understand that we are working diligently as their representatives here in this body, trying to find ways that we can raise the appropriate revenue stream to take care of the issues that are in this budget. I would urge passage of the bill.
Further discussion? If not, the question for the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk will prepare the machine. Has every member voted? If so, the clerk close the machine and ascertain the results on this question. 26 yeas, 6 nays, 2 absent, not voting. More than a majority of those present and voting having voted in the affirmative, I declare the bill passed.